Good day, grade 10. For today's discussion, I will be your facilitator. So, my name is Ramirez Jenaline Vidal. So, before we formally start our discussion, I would like you to familiarize about our classroom rules. Since we are in a online setup, first classroom rules, don't open your mic if you are not recognized. Second, be on your proper attire. Iwasan ang paggamit ng sando at short. Be attentive. Kapag tinawag, kailangang sumagot. In short, kailangang nakafocus sa ating discussion ngayon. So lastly, open your camera if you are asked to do so. So for our learning objectives, letter A, identify the Global Health and Millennium Development Goals. Letter B, enumerate the factors that affect Global Health and Millennium Development Goals. And letter C, appreciate the goals of MGD through creating poster in promoting the Millennium Development Goals, the different Millennium Development Goals. Before we start our discussion, may I ask one representative to lead us a short prayer.
So, let's pray. Good afternoon po, Panginoon. Thank you for this day, Panginoon. Another opportunity to learn new things in life po, Panginoon. And we're asking for your guidance, so God, as well as the knowledge about the discussion that we're going to tackle po, Panginoon. At ganun din po, Panginoon, ang magtuturo ngayon, Panginoon. Gabayan niyo po siya, Panginoon. In Jesus' name, Amen.
Okay, so we will start our discussion in activity. So, it's activity time. So, these students will identify the following clip arts using the letters below. And they will remember the assigned letter for each clip art. May I ask Mr. Canapi to answer this clip art. So, I will give you 10 seconds to answer this. So, your 10 seconds, Mr. Canapi, start now. So, what is your answer, Mr. Canapi? Poverty and hunger. That's correct. So, next clip art, may I ask Miss Asuncion to answer this one. So, your 10 seconds, Miss Asuncion, start now. So, what is your answer, Miss Asuncion? Gender equality. That's correct. So, the third one, Mr. Laddaran. Yes, your 10 seconds will start now. So, what is your answer, Mr. Laddaran? Reduce child mortality. That's correct. Yan. So, next, Miss Sampag. Yes, your 10 seconds. Start now. So, what is your answer, Miss Sampag? Improve maternal health. That's correct. Next, Mr. Acoba. Your 10 seconds start now. Okay, so what is your answer? Achieve universal primary education. That's correct. So lastly, may I call Mr. Soriano? Your 10 seconds start now. Okay, so Mr. Soriano, what is your answer? Combat HIV or AIDS. So, class, according to our activity, what do you think is our topic for today? May I call Miss Sampag to answer? Or what is your, ano yung hula mo na topic natin ngayon? Yes, that's correct. Our topic for today is global health and Millennium Development Goals. So, may I call Mr. Luis? Mr. Luis, what comes into your mind when you hear the word global health? Okay, precisely. Global health. The term global health rose in popularity along with the rise of globalization. Both terms improve public awareness of vulnerabilities and shared responsibilities among people for the different injustices in the world. So when we say global health kasi, it focuses on addressing health challenges that transcend national boundaries. So it recognizing that health issues in one part of the world can have significant consequences for population in other regions. It involves collaborative efforts among governments, international organizations, healthcare professionals, researchers, and other stakeholders to tackle health issues that affect population globally. So, according to according to Ilona Kickbush, 2006, Director of the Global Health Program at the Graduate Institute of International and Development Studies in Geneva, Switzerland, states that global health pertains to various health issues that that concerns and trends which go beyond national boundaries and call for global initiatives for the protection and promotion of people's health across the world. So when we say global health and Millennium Development Goals, they are closely interconnected, as the Millennium Development Goals provided a framework for addressing key global health challenges or issues. Okay, so may I call Mr. Bongbonga to please open your mic? What comes into your mind when you hear the word eradicate extreme poverty and hunger? Okay, very well said, Mr. Bongbonga. So, eradicate extreme poverty and hunger, developing countries, particularly in Africa and Asia. Particularly in Africa and Asia, suffer from extreme poverty and hunger. So, poverty and hunger may result to severe malnutrition and also lifelong physical and cognitive learning and reasoning that affects health, well-being, and the economy. So, some key suggestions to eradicate poverty and hunger are education, gender equality, more jobs, invested more agriculture, and strengthen nutrition programs for children and infants. When we say eradicate extreme poverty and hunger kasi, this goal aims to end poverty and hunger in all its forms and dimensions. It encompasses various aspects including income poverty, food insecurity, malnutrition, and access to essential resources and services. The next one. Achieve universal primary education. So, when we say achieve universal primary education, persons, particularly women, who are educated are more likely to seek medical care, especially during pregnancy, ensuring proper nutrition for their family, adopting healthy sanitary practices, and ensuring immunization of children. As an effect, infants and children have better survival rates, healthier and better nourished. So, kung ito ay ma-attain natin, yung mga bata may pwede silang magpakasal or magkaroon ng family late stage in life. Like hindi sila hindi may iwasan ang pagkakaroon ng teenage pregnancy. And also practice family planning and have fewer children. Know rights, responsibilities, and civic obligation. Seek employment and sustain personal and family needs. Have decreased risk of getting sexually transmitted infections like HIV or AIDS. Support and protection of developing and vulnerable countries during crises. Achieve universal primary education. The goal is to ensure that all boys and girls have access to free, equitable, and quality primary education. It encompasses increasing enrollment rates, improving educational facilities, promoting inclusive education, and addressing barriers to education. Next one. Sorry, wait lang. Gender equality and empower women. So may I call Miss Orpilia to open her mic. Okay, so Miss Orpilia, what comes into your mind when you hear the word gender equality and empower women? Precisely. So, gender equality means equal representation of men and women. It implies that all genders should have a equal value and treatment. Equal gender treatment empowers women and other groups, creating opportunities in education, work, finances, and promote gender other aspect which improves the economy and lessen effects of quality and financial crises. Gender equality can be achieved through early childhood development intervention. Second, promotion of women's political rights and involvement. Improve reproductive gender equality in school curriculum. Education and integration education and integrating gender equality in school curriculum. Improve women's access to work and strengthen labor policies for women. So, gender equality and empower women are crucial aspects of sustainable development and social progress. Achieving gender equality involves ensuring equal rights, opportunities, and access to resources, and also decision making for all individuals, regardless of their gender. So, yung mga babae or women empowerment goes beyond equality and focuses on enabling women to have control over their lives, make choices, and participate fully in social, economic, and political spheres. Next one. Reduce child morality. So when we say reduce child morality, programs and policies which help reduce child mortality like improving nutritional intake, healthcare facilities and infrastructure, and other fields which improve children's lives. Strengthening local and national health programs and policies is one way to reduce child mortality. So, pwede ding i-include yung immunization programs, assuring yung survival and better health ng mga mother, improving reproductive health programs and policies, and also better nutrition program for infants, children, and also mother. When we say reduce child mortality, this goal focus on reducing child mortality rates by 2/3 with targets for improving maternal health and expanding access to essential healthcare services for women and children. Next. Next one. Improve maternal health. When we say improve maternal health, may I call me Mr. Abilo. Mr. Abilo. What comes into your mind when you hear improve maternal health? Very well said, Mr. Abilo. So when we say improve maternal health, it's not only about mother's health but also involves the health and wellness of the family. Maternal health also helps eradicate other problems like poverty, inequality, decreased workforce, lower birth deaths, and disability of women. So, the objective of this goal was to improve maternal health by reducing maternal mortality rates and ensuring universal access to reproductive health care. So, some ways to improve maternal health include improve and proper nutrition of mothers, teaching the benefits of birth, spacing and small family size, educating young boys and girls about the importance of maternal health, better and improve access to hospital care, especially obstetric gynecology, prenatal and postnatal care. And lastly, combat HIV or AIDS. So, when we say combat HIV or AIDS, emerging and re-emerging diseases like HIV or AIDS, malaria, influenza, and other diseases affect productivity and growth of nations. Some of the effects of disease outbreak are loss of jobs, shortage in professional workers, and creating social crisis. Children are the most vulnerable and are exposed to exploitation and abuse, undermining their normal normal growth and development. This goal aimed to combat major infectious diseases such as HIV or AIDS, malaria, and tuberculosis by providing access to prevention, treatment, and care services. Some ways to combat or any one of you can give some ways to combat disease, including effective prevention, treatment, and care. Anyone? May I call Miss Ocampo to please open her mic. Ay, Campo, rather. Okay, thank you, Miss Campo. So, some ways is improve housing condition, increase access to anti-malaria medicines, promoting safer sex behavior, and preventive education for all, promoting tuberculosis screening of HIV or AIDS persons, and TB directly observed treatment short course therapy, promoting the use of insecticide treated nets to fight mosquito home diseases. So, kapag gumagamit kayo ng kulambo, yun ay isa sa way to combat HIV or AIDS or malaria. So, okay, so according to our discussion, kung talagang nakinig kayo, anyone, any representative to, what do you call that, to sum up or summarize what we've discussed for today. Okay, thank you, Miss Sampag, for that, for sharing your what you've learned for today's discussion. So, for your last activity, I would like you to, since we are in online setup, I would like you to make a poster on how you will going to promote one of the different Millennium Development Goals. So I will give you 5 minutes. 5 minutes to compose or to create your artwork, and mamaya I will request three students to share their artwork for in class. So your 5 minutes starts now. So start working. So yung timer natin dyan is 10 minutes. But since konti na yung time natin, let's consume 5 minutes only. Okay, time is up. So, I would like Miss Flaviano and Mr. Miss Flaviano, Mr. Bakay, and wait lang, Mr. Bakay and Miss Sampag to share their artwork in class. Okay, thank you class for sharing your output or artwork in our class. So for your assignment, I would like you to capture this as capture na lang para hindi na kayo magsulat. For your first assignment, it's true or false 1 to 5. And yung isa is matching type. Okay. Diyan na natatapos ang ating discussion. Thank you for listening. I believe that natapos natin ang discussion na ito kasi meron yung guidance ni God. So, thank you for listening and thank you for listening. God bless.